Hello everybody, Dr. Bulow here with Revive Upper Cervical, and today I wanted to take a minute and just chat about headaches. You know, of all the different conditions that patients of ours have and that we see in this clinic, one of the most common reoccurring symptoms would be the symptom of a headache. And headaches come in all different shapes and sizes. Some of the most common headaches are the headaches that we would call the tension headaches, whether it's just a band of tension around your head, or maybe a headache that starts in the back of your neck and travels up the back of the skull, even into behind the eye. And even more yet, there's other headaches that feel like there's a pressure that's building inside of your skull, pushing outward. Or maybe it's so bad it's like a migraine headache where every time your heart beats, you have that bounding pressure coming from the inside out. And the sad thing is that most people just learn to live with it, or they medicate it and ignore it. It's a sad state when we learn to live with a condition of any kind. People modify their lifestyle and just learn to live with a symptom. But equally bad is when we are medicating, ignoring it. You know, a headache is like the check engine light on your automobile dashboard. If you're riding down the road and the check engine light popped on, the first thing through your mind shouldn't be to take out a black permanent marker and cover up your engine light so that you don't see it anymore. That wouldn't be your first instinct. So my suggestion is if you're having regular headaches, we shouldn't just be medicating them again and again and again, because the reality is that there's probably something else going on that's at the root cause of these headaches. One of the most common causes to these different types of headaches is when the upper neck becomes misaligned. The upper neck is a very delicate area, and when the upper neck bones become twisted and turned, there's actually two things that can happen as it relates to these headaches. Some of the obvious things would be that the nerve coming out in between your C1 bone and your skull can become pinched. That nerve just so happens to travel up the back of the head. So quite obviously, if there's a neck misalignment, when someone has pain right at the back of their head that travels up or even behind the eye, that's usually coming from the upper neck. But even with some of the more severe headaches, migraine headaches, cluster and neurological headaches, some of that also can be coming from the top of the neck, base of the skull. And here's why. Some of the research has shown that when people have whiplash injuries, that the brain, as it sits in the bottom of your skull, can actually fall into the opening at the bottom of your skull. And if you have tissue in the opening at the bottom of the skull, that opening becomes clogged. It's kind of like if you put a dish rag and it fell into a kitchen sink, the water level will rise. And if you have a misalignment that creates pressure in the base of your skull, the fluid in your skull will become pressurized. And so now, that can lead to a lot of very intense bounding pressure headaches, vascular headaches, things along those lines. If the fluid isn't running right, you can get that mental fog and the inability to form words. It can get pretty nasty pretty fast. So those are just a couple of reasons why the symptoms of headaches could be a sign of an underlying misalignment, something in chiropractic that we call a subluxation, when a misalignment causes a neurological dysfunction. It's a very serious thing and needs to be addressed. So if you know someone that's dealing with headaches on a reoccurring basis and is smart enough to not just medicate it for the rest of their life, or they're just tired of dealing with it and they know that there's probably something else going on, please share this video with them. We'd be happy to help them out. If they're not in our area, we will gladly find someone who is nearby. If they're in a different state or a different area, we want to help them find the help that they need. But obviously, if they're nearby or are coming nearby or would like to come and see us, we'd love to be able to help them out and see if there's anything we can do. So thanks for watching. If you have any questions, please leave a comment in the comment section below, and we'll see you next time. Bye now.